Hi there, today we are going to be doing an ear exam on you. But before we start, we gotta put some gloves on. So, I have these gloves here. Okay, so let's go put them on. First glove. Wrong way. Okay, first glove on. Second glove. Okay, we have both gloves on, so we can start the examination. So I'm just going to touch around your ears. Let me know if you feel any pain, okay? Very, very good. Alright, I am also going to be looking at it with this light here. So, let me look at your ear. Other. Okay. Not going to be touching while getting the light. Very good. I'm not seeing any issues right now. There's no pain on your ears, but I do have this hammer here that I'm gently gonna press against your ears, and it's not gonna hurt. It's just gonna be very, very gentle. But let me know if you do feel any discomfort. Okay, so we're gonna begin. Let me do the little side. And let me do this side. Okay, good. So, did you feel any discomfort there? Great. Now, we are going to be looking in your ear with an otoscope, so we can see what's going on in there. So just stay still for me. So it's just a little light at the very end, and I put this in your ear. Okay, so stay still. let's look at your other ear. Okay, very good. So, I did see a lot of wax buildup. So we're just going to do a quick hearing test because we're going to see the difference between how your ears sound now and then once we do the ear cleaning. So I have this tuning fork and we're just going to make a sound on each side. I want you to close your eyes and tell me what side you hear the sound. Okay. What side was that? Good. What side was that? Okay. What side? What side? Very good. We're going to do the same thing, but with my hands. I'm going to make that sound. And you're going to tell me what side you hear that. So keep your eyes closed for me. Okay? Now let's begin. Very good. I forgot that we were supposed to get your temperature. So let's just get that quickly. Okay. Let's do the other ear. Okay. Good temperature. Okay. Sorry about that. Alright, so what we're gonna do now is just do the ear cleaning. So I have a couple things that are gonna go and scrape out that earwax. Okay, so I have this here, and it's just like a little pick on both sides I'm going to be using. So we're going to start with this here. Let's begin. ear. Switch sides. Okay. All right. Now I'm just going to clean out the rest with a fan. So let's clean it. Now let's do both sides. Fantastic. All right, now I'm going to look again with my otoscope just to make sure we didn't miss anything or if there's any redness there. So I'm going to start looking in this ear. Okay, let's get the other ear. Okay, you did very good. There's still some wax, of course, because wax is actually good for your ear. It protects your inside, so nothing to worry about there. But I was able to remove everything. So now we are going to do another hearing test. So we are going to be putting on this headset. Okay. We are going one is a beep test, and I want you to raise your hand when you hear the sound. Okay? I'm gonna start it now. It's just calibrating right now. Now, what ear do you hear the sound? All done with the test. You did a fantastic job. Now, let's continue with the hearing test. I need you to close your eyes, and we're going to be doing the tuning fork again. So close your eyes. Okay? And I want you to tell me when the sound stops. Good. 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 Okay. Now we're going to be doing the same thing that we did before with my hands. So I want you to tell me on what side you hear that sound, okay? Close your eyes again. Okay, so we are done with the hearing test. You did fantastic. I definitely can tell the difference between when you had the wax in your ear and then when we removed it. So yeah, today we were able to give a full ear exam, hearing test and everything, ear cleaning, and everything came out perfect. nothing to worry about. Even your temperature was perfect. So I'm not seeing any issues with your ears, your hearing, none of that. But yeah, thank you so much for coming in and getting this ear exam. It was very lovely to meet you, and I hope you have a lovely rest of your evening. All right, I will see you around. Bye. Hi there. Today we are going to be doing an otoscope-only ear exam on you. Is there any reason why you would only want to get this done? Okay, just a checkup. Great, we can do that for sure. Let me just start off by getting your temperature, just making sure that you're not sick at all. So stay still for me, please. Okay. Okay, good temperature here, but we're going to do the other ear. Stay still. Okay, good temperature here too. Great. Okay, so we're just going to get started. I am going to be putting an otoscope in both of your ears, back and forth, and I'm just going to observe and examine and make sure everything's good. We are also going to be checking your temperature throughout it, just making sure that you're not getting too hot or anything, but there's not going to be any beeps, okay? We're just going to be looking inside after doing the otoscope. But yeah, we can get started. You can relax or even fall asleep. We're gonna be very thorough, so you can just sit back and relax, okay? You can even close your eyes. All right, let's get started. you did a fantastic job when I was observing your ears. Everything looks so good. No wax buildup, no redness, none of that. Okay, so we don't have to worry about anything right now. But thank you so much for allowing me to observe your ears, examine them, and I hope you have a lovely rest of your evening. Okay, I'll see you around. Bye. Hi, welcome in. So you're here for a dental exam. We can get that started right away. Let me just put on some gloves and a face mask. So you've been having some pain in your teeth. Okay. Interesting. So how long has this been happening? Okay. Well, I just got my gloves on. It's pretty easy. Usually I don't do that great. But we are just going to be looking inside your mouth. So I'm just going to need you to, let me see, open your mouth wide for me. Just going to look inside, see what's going on. Okay. I do see your gums look pretty red, a bit swollen. Okay. Yeah. Okay. Same thing, but I'm going to use a different flashlight. I'll just look. Okay. Yeah. Do you floss normally? Okay. I'm just gonna put on my face mask. Actually, it's this way. Okay. So, we can begin. I'm gonna need you to open your mouth, and I'm just gonna get a quick scan of your mouth. So just keep your mouth open, and then get a scan. Okay. Good. One more. Very good. Okay, we're gonna do something like that again. This time I'm gonna need to put some like plastic around it. One moment. Let me just get this prepared. Good. Wrap that up in the plastic. Same thing here. Just stay still. Alright, just gonna change the color quickly. Okay. Just doing little scans here. Okay. Very good. Let's take out that plastic. And I'm just going to lastly get your temperature. Okay, so I have this. We always got to make sure that our patients are not sick, so we are just going to get your temperature with this temperature gun, so stay still. Okay, let's do it again on this side. Okay. Okay, very, very good. You have a good temperature. Fantastic. Just gotta make sure that you aren't sick. So we're gonna use this again. This is gonna be something where you just keep your mouth open, so it kind of helps me there. So just stay still. I'm gonna put some of this solution in your mouth, so stay still. So this is gonna help with the pain. Doing great. Good. So right now we're kind of waiting on those scans to see what is going on. So right now what we can do is I'm just going to touch around your face, around your jaw, see if the pain is also external. So just going to touch around. Let me know if you feel any pain. No pain, right? Good, okay. So while we wait for the scans, I have a toothbrush here. We're just gonna brush your teeth quickly. Okay, so just put some toothpaste on there, open wide for me. Good. Very good. Okay, and now I'm just going to use this floss here. Open wide again. So I'm looking here, and the scans are looking like, so you have a cavity, okay, and it looks like you have a lot of plaque as well. We can definitely get rid of that, and we can definitely fill that cavity, okay? Alright, so I'm just going to use this here, and I'm just going to press along your teeth. Let me know if you feel any pain, okay? Do you feel pain there? Okay, how about there? Okay. Just wanted to see what your pain tolerance was looking like. Everything looks fine there, so we can get started. We don't need to numb anything. So I'm just gonna get some tools there. So I have this tool, and I'm just gonna use this to get rid of that plaque that's in between your teeth. Okay? Let me know if you feel any pain. We are able to get rid of some of the plaque, and I'm just going to spray some water. Okay, so just open wide. So now we need to get that cavity filled. So here is basically your teeth, okay? So it's looking like you have a cavity here and on the other side as well. This one isn't as bad. This one is very deep, and we're gonna fill both of them today. Okay, the rest of your teeth look very good. There was some plaque in between the teeth, but you know, sometimes that happens when you don't floss enough. Even if you do floss a lot, sometimes, you know, stuff gets stuck and it's hard to get to. So totally okay. But yeah, we're gonna get rid of or fill these two cavities. So we're gonna do that right now. So I'm just going to put a sheet on you quickly. Alright, just stay still. Good. Just don't want to dirty your shirt here while you're moving. There's gonna be water spraying all that. Okay, good. So I'm gonna take this tool and this tool. So I'm gonna be spraying water while filling the cavity. So We're going to start off with this tooth here. Stay still, okay? Okay, just going to use this. Let's do the other side. Okay. Just gonna touch around. Very good. All right. Now I'm just going to use this again, this tool, and touch around. Keep your mouth open. Does that hurt? Very good. Let's take off that sheet. Alright, we are going to do a few more scans to see if we were able to fix the problem. So I'm going to do the scans from before. Here. So we're going to just do that. Keep your mouth open. Alright, ready? Good. Good. Other side. Perfect. Great. Okay, we don't have to do the other scan, just that one, but we're going to do a different one. This one measures the heat. Let me try to change the, there you go. Okay, so this measures the heat around your jaw. So just stay still for me. So your temperature is looking good there. All right. Can you open your mouth for me? Just want to look inside while we wait for that scan. Keep your mouth open. I'm going to be touching in your mouth. Okay. Good. just got your scan. So the plaque definitely has improved. I don't see as much plaque as you had before. And let's see, your cavities look good now, filled. Okay, so I'm just going to end the appointment here, and we're going to be sending you home with some pain medication to help with that area, because it is going to hurt. And try not to eat anything that you need to chew. I would recommend like soup, something like that, something easy to eat to not irritate your back teeth. But yeah, I think that is the end of the appointment today. Everything is looking really good. We were able to do everything perfectly. But yeah, thank you so much for coming in. Thank you for letting me examine your teeth. And I hope you have a lovely rest of your evening, okay? Alright, I'll see you around. Bye-bye. Hi. Today we are going to be examining your ears and making sure that everything is looking good. Now I'm just going to be putting in my gloves, okay? I have one glove. Can you hear the sound? Can you hear that? Can you hear that? Let's put on the first glove. First glove is on. First glove. Now the second. Alright, we have both gloves on. And I'm just gonna touch your ear, okay? Just gonna touch your ear. Make sure that everything looks good. Touch your ear. Let's touch your ear. I have the light. I'm just going to look. Now let's use an otoscope. Okay, an otoscope goes in your ear. Okay, there's a little light at the tip. Alright, so we're just gonna focus on this ear first. So let's use the otoscope I was talking about and just look inside, okay? also going to be cleaning it, so I have my tool. So let's start cleaning. Alright, let's use the other tool now. So same deal, just a little different. Let me touch your ear. Okay. Now we're gonna blow some air to get rid of that wax that was in there. That's now in the outer. Okay. Okay, let's do the other tool. So this one here, same deal. Okay, does the same thing. Okay. Now, let me look inside your ear. I think that's what we did next, yeah. Yeah, let's look inside to see how it looks now. Okay, everything inside looks good. Now we are just going to spray that water that we did before, so that liquid, and here it is. So it's going to go all around your ear, okay? So, just stay still. Good. Let's see, what did we do next? I think we used the hammer next. Okay. So this hammer, like I said before, it tests your sensitivity. So we're gonna see how sensitive your ear is. So we're gonna be tapping it, but it's not gonna hurt at all, okay? Okay, I'm gonna begin. examination. Oh, the ears look fantastic. We were able to clean them and make sure that your hearing is good, which it is. So everything looks good. Thank you so much for letting me examine you, and I hope you have a lovely rest of your evening, okay? Alright, I will see you around. Bye. Hi there. Today we are going to be examining your ears, and I'm just going to start by putting on some gloves, okay? So we are going to take an otoscope once I get my gloves on, look inside, maybe do some ear cleaning if there is a lot of compacted wax or anything in there. Put the glove on. Okay, first glove is on. Now let's put on the second glove. Okay, both gloves are on. So let's just look at your ears. I'm gonna be touching. Just gonna see if there's any like lumps or bumps. So okay. Do you feel anything weird on that side? Okay, great. How about on that side? Okay. I'm just gonna get a light and we are gonna go from there. We're gonna do kind of the same thing. So I'm gonna light. I'm gonna be looking at your ear. Okay, now let me look at the other. I'm not seeing any lumps or bumps, and you have no pain, right? No discomfort. Great, yeah. That's a very good sign, but we definitely need to look inside to get more of the bigger picture of what's going on in your ears. But we are first gonna get your temperature. So I have this temperature gun here, and I just need you to stay still. I'm gonna be putting this in your ear, and there's gonna be a beep. So just stay still for me, okay? Okay. Now let's do the other ear, okay? Okay, good temperature. So you're not sick at all. Okay, now I'm just going to, first before we start looking inside the ear, I'm just going to examine like the outer. So I have this tool here. Okay, let me just change the mode. Okay, let's see here. And I'm just going to be tapping against your ear, and we're just going to scan and see if there's anything wrong with the outer of your ear, okay? I'm just going to start with this ear here. Okay, let's do the other one. Let me do one more color. Okay. And then we're going to start back on this ear. Okay. Let's move on to the next ear. Very good. Okay, so everything on your outer ear is looking fantastic. Not seeing anything that is concerning. So now we're gonna move on to the inside of your ear. I have an otoscope. I need to put a cap on for it. Okay. All right. So we have a new cap for you, and I'm just going to be looking inside, looking for any impacted wax or anything like that. Okay, so we're gonna just see if everything's good inside. Stay still. Stay still. We're gonna work on this ear first. All right. Okay, good. Everything kind of looked impacted there. I did see some wax kind of like pushed back into the ear canal, so we definitely need to work on that and clean it up. But let's see if you have that same issue on the other side, okay? So I'm going to be putting the otoscope on this side, okay? So just stay still. Okay, so I looked at both sides, and I think both of them pretty much had that same issue with the compacted wax. Basically, how this happens is if you use a Q-tip and you try to clean out that wax, but it really just gets pushed in if you have a lot of wax in there. So it's very common, happens a lot because people use those Q-tips to clean ears, but it does a lot more harm than good. But we can definitely remove all of that wax. But before we do that, I just want to do a quick hearing test to see if your hearing improves when we remove the wax. okay? I'm just going to be doing this with my hands, and I need you to tell me what side you hear the sound. So I'm just going to need you to close your eyes so you don't see when I make that sound. Okay, so close your eyes, close your eyes. Very good. Okay, so just tell me either left or right. Okay, I will begin right now. Okay, very good. You can keep your eyes closed. I have a tuning fork, and this time I'm going to hit the tuning fork. It makes a sound like this. Okay, and I want you to tell me when the sound stops. I need you to keep your eyes closed for this, okay? Keep your eyes closed. All right, let's begin. So, when the sound stops. All right, very, very good. So I do see some issues with your hearing, but you did pretty good. It's just kind of the lower sounds are kind of affecting you, but once we clean out your ears, everything will go back to normal, okay? So I have this tool here, and I'm going to use it to clean your ears. There you go. So I'm just going to try to scrape it off, pull it out of your ears. Okay, this one you need to stay very, very still. Okay, so I'm just going to start with this ear. All right, let me know if you feel any pain. I'm going to be as gentle as I can, okay? All right, stay still for me. Okay, we were able to get rid of most of your wax there. Now let's do this other ear. Like I said, stay still. If you feel any discomfort, let me know and we can stop right away. All right, let's do this ear now. ears, that one had a little bit more wax in it. I'm just going to touch around your ears to make sure you're not feeling any pain. Great. Now I have a fan and I'm going to brush your ear to make sure we get all the wax that went on your outer ear. Okay, just clean everything up. Very good. Now I have this syringe. I'm just going to blow some air, okay, in your ear, just to make sure everything's good. To the other ear. Very good. I'm going to look quickly with my otoscope again, just to make sure that we were able to get everything and that we didn't irritate the inside of your ear. So we're going to check this ear very quickly. Okay. Good. Everything looks good inside. Now let's look at the other ear. Alright, fantastic. Both sides have no redness, and we were able to get rid of a lot of that earwax. Having some earwax is good, though. We didn't take out everything. So what we're going to do now is just make sure that we didn't irritate the ear at all. So I have this hammer, and I'm just going to tap against your ear. It's very, very gentle. See? Doesn't hurt at all. So I'm just going to tap your ear and make sure that you don't feel any pain, okay? All right. Perfect. All right. Now let's do the other side. Okay. You didn't feel any pain, right? Good. Yeah, I wasn't seeing any twitching or anything like that. So now you're gonna close your eyes and tell me how many times you hear that sound, okay? Alright, so close your eyes. Now, let's begin. How many times was that? Good. That was 8 times. Now, let's do it again. How many times was that? Good. That was 6 times. Now, last time. How many times do you hear it? Alright, how many times was that? Good. That was 10 times. Alright, now we're going to use the tuning fork again. And you're going to tell me what side you hear the sound. Okay? So keep your eyes closed for me. And let's begin. What side was that? 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 Very good. Now you're going to tell me when the sound stops. Good. Oops. Good. Very good. You can now open your eyes. Okay, so we are finished with your ear exam. You did fantastic. There was a little bit of an issue with your hearing before we got rid of the earwax, but I'm seeing a huge improvement, so nothing to worry about there. We're going to be sending you home with some ear drops that are going to help with irritation or redness because we did get rid of a lot of wax. But yeah, you did great. I'm not concerned at all about your hearing or your ears. So yeah, everything's looking good. But yeah, thank you so much for letting me examine your ears, and I hope you have a lovely rest of your evening. All right, I will see you around. Bye. Hi, so you came here for this eye exam because you have some problems with your eyes right now? Okay, I'm just gonna shine a light. Can you tell me a little bit about what's been going on? Okay. Alright, I do see some redness already with your eyes. Can you follow the light? Okay. Is that light too bright for you? Okay. So you're not following it correctly. Okay. Can you look up for me? Look up for me. Yeah, up right here. Good. Look down. Okay. Look up. Look at the other eye now. And look down. Can you look left and right? Okay. I am seeing some issues here. Can you follow my finger? I'm thinking maybe it was the light. Maybe it was too bright for you. Okay. Yeah, I mean, have you had issues with this before? Have you gone to an eye exam before? Okay. Do you wear glasses? No. Okay, so it might not be your eyesight that's causing you not to follow correctly. Interesting. I have a couple colors here, okay? Can you tell me what this color is? No, it's not blue. This is red. Okay, so I'm going to take my light again, and I'm just going to make a shape, okay? And you're going to tell me what shape. Okay. What shape was that? Oh, okay. And what shape is this? No, that wasn't a circle. How about this one? An octagon? No, that was a circle. Okay, let's see. How about this one? What color do you see here? Okay, I'm just going to make a shape. What shape is that? No. How about this one? No. Okay, let's do the last color. And what color is this one? You're close. Let's see the shapes. Okay, no. How about this shape? No. And this one? Okay, so I'm not sure what's going on. It looks like you have a lot of things wrong, but we can definitely try to figure it out. Maybe you have a fever or something and you're hallucinating. So I have this temperature gun and I'm just gonna put in your ear and see what your temperature is. Maybe you're hallucinating or something, but I don't know. I guess we'll see. Okay, so just stay still. I'm gonna put in this ear. Okay, I'm gonna get the other side now. So this ear. Okay, let's put it. Okay, your temperature is perfect. So not caused by a fever or anything like that. We can definitely figure this out though, okay? I have this light now. I'm just gonna look really deep into your eyes, so try to keep your eyes open. Okay. All right. Okay, let me look at the other side. Okay, now I'm gonna look on this side and I'm gonna open your eyelids with my hand, so stay still. Try not to blink, okay? Good. Let me look at this side now. Okay, so I'm seeing a lot of redness. One pupil is also bigger than the other, so that's a little bit concerning, but we can get down to the bottom of it. Let's see. So I'm gonna do another test, 2 more tests that are gonna just test how your eyes react to things. So I want you to follow this hammer, okay? Follow this hammer. Just with your eyes, not with your head. Just your eyes. Just follow it. Okay, not with your head. Okay, just your eyes. Okay. Okay. Yeah, I don't know what's going on. I've never had anything like this, really. I feel like you're not doing well with any of the tests at all. Let me see here. We're gonna kind of do the same thing, but you're gonna follow this stick. Okay, just follow the black dot. Try not to move your head. Okay, just follow it. Just the black dot. Okay. Yeah. All right, you're doing okay. All right. We're gonna do another test. Okay, I want you to look at my finger. Okay, now look at my light. Look at my light, not my finger. Look at my nose. Look at my nose. Look at the light, not my finger. Look at my nose and the light and my finger and my nose. Okay, look at my nose, my finger, the light, my finger, the nose, and my light. Okay. I am going to test your eyesight now. So I'm just going to cover one eye. Okay, so you see my hand here? Okay, now I want you to tell me what number you see on my hand. Okay, ready? Okay, let's do the other side. Okay, do you see my hand? Okay, ready? Let's go. Okay, so it looked like you did a lot better on the first one. So what's going on with the second one that we did? Okay, it looked pretty blurry for you. Interesting. Okay, so I'm thinking this eye, I don't know, really. I think one of your eyes is blurry while the other one really isn't. That's where I'm looking at now. Also, I'm a little concerned with the colors earlier, so we're going to do a color test right now. Let me just grab this quickly. Okay, so we have this color blindness test, and I want you to tell me what number you see in the circle. Okay, right here. Okay, so this number is 12, not 13. Okay, what is this one? Okay, so this right here is an 8. Alright. How about this one? Okay, yeah, it's 29. Let's change the color here. I'm actually going to cover one of your eyes. Okay, what number do you see? Okay. Covering. What number do you see? Okay. Interesting. I'm covering one eye. What number do you see? Good. It's 42. What number? Okay. We can stop there. I'm thinking one eye is affected. Like I said, I did see one pupil was bigger than the other. Honestly, that's a little bit concerning. So I have these two lights. We're going to keep going with the color tests. Let me just get the right colors. I'm sorry. Okay, I have them. Now, can you tell me what colors you see? Okay, I'll cover one eye. What colors do you see? Okay, cover the other eye. What colors do you see? Okay, I want you to follow the blue light. Follow the blue light. Even when the green light goes in front of your face. Okay, now follow the green. Okay, we're going to change the colors. Okay, what colors do you see now? Okay, just follow this color. Okay. Now follow the other color. Now I want you to choose a color, either one, and follow it. You pick your own color. Very good. Okay, so I have this mask that's gonna go on your eyes, and I want you to tell me when you see the sparkles, okay? Good. Okay. Okay, let's do the other eye. Good. Good. That test was definitely a lot better. Okay, now we're gonna work on your peripherals. So I have this light now, and I want you to tell me when you see the light in your vision, okay? Okay, now tell me when the light leaves your vision. Okay, very interesting. I'm going to touch your eyes. Tell me if you feel any pain, okay? Do you feel any pain there? Okay, now what I'm gonna do is just get some lens and we're gonna see maybe if it's the eyesight that's affecting you, okay? Okay, so I have a bunch of lens here and we're just going to test your eyesight. Okay, so let's see. Let's go with this quick lens. So how is that looking? Can you see clearly here? Okay. And how about this one? Can you see clearly out of this one? Okay. Now, let's do a lens 1 or 2 test. So let me know which lens is better. So let me just get 2 lenses here. So lens 1 or 2? 1 or 2? 1 or lens 2? Okay, so one is doing something a little bit different than the other. So what is the difference between this lens and then this lens? Okay, interesting. All right, let me get 2 different lenses. Okay, so we have lens 1, okay, and we have lens 2. Lens 1, and we have lens 2. Lens 1, and lens 2. Okay, so lens 2 is really, really blurry. Interesting. Okay, we're going to use the same lens as that first one. So lens 1 and lens 2. Lens 1, lens 2. Lens 1, and lens 2. What's the difference that you're seeing there? Okay, let's get a different one. Okay, lens 1 and lens 2. Lens 1 with lens 2. Do you see a difference? So which one's clearer? Lens 2? Okay. How about when I do this? Okay, so it looks like that. How does that look? Which one's clearer? Okay, interesting. Okay, let's get this one here. Okay, we have this. Now, there. Which one's clearer? Lens 1 or lens 2? Lens 1, lens 2. Lens 1, lens 2. Okay, you did very, very good. Let me just put these lenses back. So I have this measuring tool right here. Like I said, your pupil is looking a lot bigger than the other, so I'm just going to measure it and see what's going on there, okay? So stay still for me. So, I think ultimately the pupil is the issue. Let me see if I can try to fan it, massage it, and kind of help it settle in. So close your eyes for me. So I'm just going to brush your eyes with this fan. Okay, let's do the other side. Okay, now I'm just going to massage your eyes. Keep them closed for me. Okay, good. I'm going to put on these new glasses on you, and I want you to tell me if you can see the colors that I show you, okay? So I'm just going to put this on you. Okay. Good. Now tell me what color this is. What color is this? And what color is this? Okay. Now I want you to follow my finger. Now look at my nose. Now my finger. Now my nose. And my finger. Okay, so already I'm seeing like your pupil going back to normal size. I think the massaging helped, and I also think the other issues was your prescription needed to be changed. So after looking at those lenses, we were able to find some glasses that worked the best for you. So I think that's ultimately what needed to be done there. But your eyes are looking a lot better. You passed all the tests at the very end, so I'm not worried at all. I will be giving you some eye drops that you can take home to kind of help with that pupil. That's a little bit bigger than the other one, so that will definitely help if you still have these issues, because I'm seeing that you don't anymore with the glasses. But if you see you still have these issues these next couple days, you can make another appointment with me and we can look further into what the issue is, okay? Okay, but it was very lovely to meet you, and I'm glad we were able to figure out what was going on. All right, I'll see you around. Bye. Hi. Today we are going to be doing a face exam and face massage on you. I'm just going to start by putting on some gloves, okay? And we will begin shortly. Is there anything you really want to focus on, like your cheeks, your nose, forehead? Okay, so just like a little bit of everywhere. Gotcha. Okay, we can do that for sure. Let me just put this last glove on. Perfect. Okay, so I'm just going to first examine your face. So I have this light. I'm going to be touching your face as well. So, let's see, let's use this other light instead. Okay. Okay. Do see where we can work, some areas we can work on. definitely see some spots that are really dry that we can warm up. Other things too. Just okay. Yeah. No worries. We can definitely get started. Let me just first get your temperature just to make sure that you're not sick or anything. So we're just gonna put this in your ear. Okay, stay still for me. Okay. Let me do the other ear just to be safe. Okay. Right, good temperature. Nothing to worry about there. What we're gonna do first is just measure your face. So I have three different measuring tapes. So we're gonna start off with this one. So just stay still. Okay, let's do a different one. Okay. Just measuring your face. Okay. Last one. This one's a bit more finicky. Okay. We are all good with the measurements. So I'm just gonna move your hair to the side. Okay. Good. Alright, we can start now. So I'm just gonna start off by getting rid of any impurities in your face, like any dirt or anything like that. Okay, just going to rub these into some soap. They're little fans that are just gonna rub against your face. Okay. Alright. Just taking out any dirt, any dirt. Perfect. Okay, we can begin now. We're just going to start off with this here. And put it on. This one has different colors and it's just going to help clean your face. Okay, so just stay still. We're going to do different colors. Let's do blue. Last one for this one. Very good. Okay. Just going to use the brushes again, gently. To the other side. Okay. Now let's move on to the next set. Okay, we have this. It's going to put some warmth around here, your neck. Alright. On the lowest mode. Okay. I'm just gonna bring it up. Good. to massage around your neck. Okay. Doing good. Just go over your hair. Good. I'm just going to be massaging around your cheeks, your forehead, all around your face, okay? Now I'm going to test your face temperature. So I have this temperature gun here. Stay still. Okay, good. Next up, we have this here. It's going to put a lot of heat on your face. This is going to help with dryness. Okay, so I'm just going to scan your face like that. Right? Okay, let's begin. Let's just do one more scan, one note vibration. Very good. we are gonna just do the temperature gun again, just to make sure that everything is not looking too hot, okay? Everything's looking fantastic. Right, let's use the fans again. Swiping any impurities. Swap your hair. Okay, just going to massage your face again. I'm gonna use my light. Look. Your face looks so good. Super clean. I can see less dryness now. Looks fantastic. Mm-hmm. Good. Yeah, everything looks amazing. We did such a good job on your face. You look beautiful. But yeah, that is it for our face massage, our face exam. So everything looks great. We'll be sending you home with some moisturizer that you can put on your face to keep it super moist. Then you can start combating that dry skin, okay? Alright. It was very lovely to meet you, and I hope you have a lovely rest of your evening, okay? See ya. Hi, welcome in. So you're here for your annual doctor exam, right? Okay. So we are just gonna get started right away. I have 2 temperature guns. One just goes on your forehead and then one goes in your ear. We are gonna start with the one that goes on your forehead. Stay still for me so I can just get this temperature. Okay. Now we are gonna be doing the other temperature gun. That way we are super accurate. So this is gonna go in both of your ears. So just stay still for me while I put this in your ear, okay? Making sure it's a good fit there. do the other ear. So this one here, just gonna put it in there. Make sure it's a good fit for you. Okay. Alright, your temperature is looking good. Doesn't look like you have a fever. I am just gonna put my gloves on. And I was curious if you've been sick recently in the past 2 weeks. Okay. Anything throughout the year that was concerning or any changes? Okay. Get your first glove on. Now let me put my second one. Great. Okay. So I'm just gonna start with my light. Okay, so now I want you to follow my light with just your eyes. Do not follow with your head, just your eyes. Okay. You're doing great. Good. Okay, now I want you to look at my nose. All right, look at my nose and tell me when you see the light, okay? Good. Very good. Keep looking at my nose. Now we're going to do kind of the same thing, but I want you to look at my nose still and tell me when the light leaves your vision. You're doing great. Good. Great. Okay. I'm gonna get the light kind of close and I want you to look up for me. Look up for me. Okay. Now look to the left. Now the right. And now look down. Very good. Okay, other eye. Look down for me. Look down. Look down. Now look up. Now look to the left and to the right. Awesome. Great. I'm going to look inside your ears with this otoscope here. Okay. Stay still. Now I'm going to look at your other ear, okay? Stay still. Okay. Very good. I'm not seeing any redness or anything like that. So now I'm going to listen to your heart and your lungs. So I'm going to put this on. Okay. All right. So just going to put this on your chest. Okay. All right. So just breathe normally for me, okay? Just breathe normally. Okay, now take a deep breath. Okay. Good. Okay, take another deep breath. take one more deep breath. Good, good, good. Great. Okay, now I'm just gonna get behind you. Okay, good. Now just breathe normally. Just breathe normally, okay? Good. You're doing great. Okay. Just breathe normally. Just breathe normally. Alright, now I need you to take a deep breath for me. Okay, ready? Good. Alright, another deep breath for me. Very good. One last deep breath. Very, very good. Okay. Your heart sounds really good. I'm not hearing wheezing in your lungs, so everything sounds normal. So now I'm gonna get your blood pressure. So I'll just choose an arm and I'll wrap it around. Okay. Alright, awesome. Alright, just stay still for me and keep your arm flat. Okay, so now looking at it, your blood pressure looks good. Nothing to be concerned about, so that's great. Now, I'm just going to look inside your mouth, so open wide for me. So I have this light here. Open wide. Good. Very good. Okay. Get a little light here. Okay. Now, can you cough for me? Good. Good. Everything looks good there. I don't see redness. I don't see any tonsil stones, so everything's looking great there. Let me look deeper in your eyes. Look over here. Okay. I'm gonna get pretty close. Try not to blink. Very good. Okay, you can blink. Blink, 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 blink. Okay. Good. Let me look at your other eye. Awesome. Okay, just look at the light. Beautiful. Good. Now I'm gonna put this on your eyes. So just gonna block out your vision. But right here has some little dots shine through, okay? So tell me when you see those dots shine through like this. Do you see that? Perfect. Okay, let me know when you see that. Good. 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 Right, now tell me when they go away. Good. 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 Now let's do your other eye. Right, same deal. Let me know when you see them. Good. 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 Now let me see, or tell me when you no longer see them. Good. Good. Very good. Now we're going to bring back my other light. Okay. All right. So I want you to look at the light, not at my hand, okay? All right. Tell me what number I'm showing you with my hand, okay? Ready? But you have to look at the light. Good. 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 Okay, same deal. The light's on the other side. Okay, just look at the light and not at my hand. Ready? Very, very good. So I want you to look at my light, not my nose, not my finger. Okay, now don't move your head when we do this, okay? We're gonna go pretty fast. All right, look at my finger, not my nose, now the light. Okay, look at my finger, my nose, the light. Look at my finger, the light, my nose. Look at my finger, the light, and my nose. Look at my finger, now the light. Now look at my nose, my finger, the light, and my nose. Very good. Okay, now I want you to just look at the light. Look at the light. Don't move your head. Good. Again, just look at the light. Look at the light. Good. Okay, look at my finger. Good. Look at my finger. Very good. Now, I want you to look at this. Look at the very tip, okay? Look at the very tip. Right? Don't move your head. Just look at the tip. Sorry. Just look at the tip. Very good. Just look at the tip. Look at the tip. Very good. You're doing fantastic. Great. Now, I'm going to cover one eye. Okay. covering one eye. Look at the light. Good. Perfect. Just seeing how your pupils react to the light. Very good. Now I have this color blindness test, and you're just going to tell me what number you see. Starting with this page, what number do you see? Good. What number? Right here. Good. What number here? Good. What number here? What number here? Changing the colors. What number? And what number here? Good. And change again. What number? And what number? Great. What number here? Good. What number? And what number here? Fantastic. Okay, you did really good. I don't think you have color blindness. You passed. You got them all correct. So that was fantastic. Now we're going to focus a bit on your ears. So I have this tool here that's going to blow some air in your ear. So let me know if it feels weird or you feel pain or uncomfortable, okay? So stay still. Good. Now let's do that other ear here. Okay, stay still. Perfect. Okay, so that didn't bother you, right? Great. Okay, now we're gonna use this tuning fork here, and I want you to tell me when you no longer hear this sound, okay? Good. Very good. Very good. Fantastic. Okay, now we're gonna do kind of a different hearing test here. I'm gonna use my hands and make that sound. Okay, so tell me what ear you hear that sound, okay? All right. fantastic too. Alright, so looking at everything, it looks like you are super healthy. Your eyes look really good. Your ears look really good. Not worried about anything else, that you're sick or anything. So this was a perfect exam. But yeah, it was very lovely to see you, and I hope you have a lovely rest of your evening, okay? Alright, I'll see you around.